Good morning, friends and colleagues. My name is Andy Marsh, Chief Constable of Avon and Somerset Constabulary. It's my great pleasure to chair this next session, and we have got some fantastic speakers. Now, goodness knows what you all expected 2020-21 to be, but it's been a year of COVID inequality around health. It's been a year of a spotlight shone on inequality for race reasons and gender reasons, and we have got now a very, very distinguished speaker. Professor Sir Michael Marmot is going to talk to us about health inequality. He has a global reputation. I could spend 30 minutes introducing him. He's the Professor of Epidemiology at UCL since 1985. That's before I got into policing. He's got a remarkable long list of awards, presentations and positions held. I was particularly taken to read that he's an advisor to the World Health Organization, indeed won their World Health Organization Hero Award, which is a remarkable achievement, knighted in 2000 for his work on epidemiology, health and inequality, and the author of a really landmark piece of work on health inequality called Build Back Fairer. So it's my pleasure to introduce for 30 minutes, followed by some great questions, I hope, Professor Sir Michael Marmot.
Thank you very much. And I want to do this in two parts that are linked. The first is to show you the overlap between the social determinants of health and the social determinants of crime, and then make the case that what we then need to do is to address inequalities in society. My book, The Health Gap, began with this question: why treat people and send them back to the conditions that made them sick? The healthcare system is of vital importance, just as the police are of vital importance. But I want to deal with the conditions that make people sick in the first place and the conditions that underlie civil unrest, crime, and the like. In the health gap, I have the example of Baltimore. Stark inequalities. I give two modal people. LaShawn's grown up in the Upton Druid Heights neighborhood in Baltimore's inner city. Bobby has grown up in Greater Roland Park. Life expectancy in Upton Druid is 63, in Roland Park, 83. If you were living in Roland Park and you wanted to see what it was like to live in a place where life expectancy was 20 years shorter, you could fly to Ethiopia. Or alternatively, you could go a few kilometers across town to Upton Druid. So what was it like for LaShawn growing up in Upton Druid? Half are single parent families. Median household income in 2010 was $17,000. Kids do poorly in school. 50% missed at least 20 days. 90% did not go on to college. And each year, a third, aged 10 to 17, were arrested for juvenile disorder. A third each year, which means the majority will have a criminal record by age 17. In theory, the slate is wiped clean at 18. In practice, you go for a job and they say, have you ever been in trouble with the police? You could lie, which is not a very good qualification for a job. So it's a problem. And 2005 to 2009, 100 non-fatal shootings for every 10,000 residents and nearly 40 homicides. And then I visited Roland Park. 93% two-parent families, median household income, $90,000, not $17,000. The kids do very well in school. Only 88% miss 20 days a year of high school. 75% complete college. Remember, in Upton Druid, 90% did not go on to college. Here, 75% complete college, juvenile arrests 1 in 50 each year, not 1 in 3, no non-fatal shootings, and 4 homicides per 10,000. Starkly different. Differences in health, differences in crime, and contact with the police system. This is not Baltimore. This is 2 hours drive from Alice Springs in the Northern Territory of Australia. This is downtown Arayonga, the council office, the health clinic, and the store. That's it. A thriving metropolis of 200 persons. And Indigenous Australians have very high rates of contact with the criminal justice system. In Alice Springs, this building looms over the whole town, the Supreme Court of the Northern Territory. Even bigger than the hospital is the Supreme Court. For Indigenous Australians in the Northern Territory of Australia, the incarceration rate is 2,400 per 100,000. For the non-Indigenous residents of the Northern Territory, it's 186, a 13-fold difference. 84% of the prison population is Indigenous, whereas 27% of the general population is Indigenous. Diagnosed mental illness in prisoners, 72% in males, 92% in females. Putting people with mental illness in prison. Incarceration rates, the US nearly 700 per 100,000, the UK 170, Japan just under 50. Remarkable differences. I had a quick look a while ago about crime and mental illness in Europe. Denmark, it said violent offending, 10% of males and 26% of females have mental illness. A UK estimate, 80% of all criminal activity attributable to people who had conduct problems in childhood and adolescence. So somewhere between 10 and 80% is a lot. It means that prevent mental illness in children, or putting it more generally, act on the social determinants of mental illness in children, and you will be acting on the social determinants of crime. Putting people with mental illness in prison has to be just about the worst place to treat their mental illness. And that comes to, therefore, if we want to take action on the social causes of crime and health inequalities, we need to look at what's going on in society. I was invited by the then Prime Minister, Gordon Brown, in the wake of the WHO Commission on Social Determinants of Health, which I had chaired, to conduct a review in England of health inequalities. And we called our review, the Marmot Review, Fair Society, Healthy Lives. In February 2020, I looked back at what had happened since the Marmot Review in 2010. So it's the Marmot Review 10 years on. And my simple summary was, we've lost a decade and it shows. Life expectancy, which had been improving about 1 year every 4 years for women and for men, in 2010-11 slowed dramatically, and that improvement just about ground to a halt. What happened in 2010 that led to this slowdown in a century-long improvement in life expectancy? Well, we had a new government elected. Could it be something the government did? Austerity, perhaps? People said, before you blame austerity, deal with the possibility that perhaps we've reached peak life expectancy. It has to slow sometime. Well, yeah, maybe. But if we look at annual life expectancy improvement in weeks, 2011 to 2017, Estonia, Norway, Slovakia, Hungary, Denmark, all of these countries, all had a more rapid increase than did the United Kingdom. The only big countries with a slower increase than ours were Iceland, well, not big, rich countries, and the United States. So no, we had not reached peak life expectancy. This was a slowdown more marked than we saw anywhere else except, essentially, the US. Here's the social gradient in life expectancy. And I call it social gradient because inequalities in health are not confined to poor health in the poor. This is deprivation deciles, deprivation of where people live. In the most deprived 10%, life expectancy is shorter than everywhere else, but it is a gradient. The less the deprivation, the longer the life expectancy. The gap between the least deprived decile and the most deprived decile was 9.5 years for men, 7.7 years for women. And that gradient got steeper, the gap got bigger, the inequalities increased over the 10 years. And if we look by region, this is women, similar picture for men. For the least deprived 10%, it doesn't much matter where in the country you lived. If you're rich, it doesn't much matter where you live. And life expectancy improved gently in every region. For the most deprived 10%, life expectancy went up in London and went down pretty well everywhere else. And it matters enormously where you live. Much bigger regional differences for the most deprived 10% than for the least deprived. So in my 2010 Marmot review, we had 6 policy domains: give every child the best start in life, education and lifelong learning, fair employment and good work for all. Number 4, having enough money to lead a healthy life. This has come to the fore with food insecurity and eligibility for free school meals during the pandemic. Healthy and sustainable places and communities, and taking a social determinants approach to prevention. What do I mean by that? Look at healthy eating. If people followed the healthy eating guidance, those in the most deprived 10% of household income would have to spend 74% of their income on food. That's what I mean by taking a social determinants approach to prevention. It's not enough to tell people to eat healthily. They have to have the capacity, i.e. the money, to eat healthily. Could austerity have played a role? Well, we know the government elected in 2010 stood for one thing: getting the public finances in order, austerity, cutting back public spending. In 2009-10, public spending was 42% of gross domestic product, and they really did cut it back. They rolled back the state. That 42% went down to 35% by 2018-19. And it was done in a regressive fashion. In my 2010 report, I called for proportionate universalism. So if this is the social distribution, that's the health outcome we're trying to achieve. That's what it looks like now, the social gradient. So we want effort right along the social gradient, but with effort proportionate to need. We have to work harder the greater the deprivation. So what happened? If you look at spending in local government, by deprivation of the area, in the least deprived 20% of areas, the total local authority spending per person went down by 16%. And then the greater the deprivation, the greater the reduction in spending. This isn't spending proportionate to need, this is spending inversely proportionate to need. The greater the deprivation, the greater the need, the greater the need, the greater the reduction in spending. Could that have played a role in worsening health inequalities? Yeah, I think it could. And this economic model policy didn't work in its own terms. This is wage growth in the UK 2007 to 2018. There's the UK, negative wage growth. The only OECD rich countries with worse performance were Mexico and Greece. Portugal and Italy were equally bad. But then every other country had positive wage growth. So these policy of austerity that was supposed to get the economy back on track, if one measure is wage growth, it didn't work. And we suffered regressive cuts in public spending. Child poverty. If we want to take action on the social determinants of health in childhood, let's reduce child poverty. So this is a relative measure. Child poverty is defined as living in a household at less than 60% median income. Before housing costs, 18%. After housing costs, 27%. And that 27% went up to 30% over the decade. So child poverty went up. And this had something to do with it. These are long-run impact of the tax and benefit reforms that the Chancellor made by income decile and household type. So look, the green is working age families with children. If you were in the bottom 10% of household income, your income would go down by 15% as a result of changes the Chancellor made, planned changes to the tax and benefit system. If you were in the second bottom decile, it would go down by 12%. And then the richer you were, the less the reduction. Wow. If the Chancellor had set out to make the poor poorer, particularly families working age with children, he could not have done a neater job than that. Sharply regressive public policies. And there were cuts to all sorts of services, including in local government, counselling for young people. Is that why violent crime went up? There was a dip, and then it increased and follows the social gradient. Most deprived, least deprived. So it went up everywhere, but went up more in the most deprived areas. So I produced my February 2020 report, the Marmot Review 10 years on, 10 years after the original Marmot Review. I only waited 10 months to publish Build Back Fairer. And I called it not Build Back Better, but Build Back Fairer. We said at the beginning that the pandemic would expose and amplify the underlying inequalities in society. Look at this. The dark green is the social gradient in mortality from all causes. I showed you life expectancy before, but mortality is the obverse. And here's the social gradient in mortality from COVID-19. They look pretty parallel. In other words, the social determinants of inequalities in COVID-19 are very similar to the social determinants of inequalities in health more generally. Now, there's some relative excess down here at the bottom for COVID-19, which we think is related to exposure in frontline occupations and living in overcrowded, possibly multi-generational households. In other words, dealing with the virus, yes, the vaccine is of vital importance, but so too is addressing inequalities. That was males, this is females. And then we have the ethnic issues. Mortality from COVID-19, Black African, Bangladeshi, Black Caribbean, Pakistani, Indian, it's elevated, but not quite as much as these other four groups, women and men. And then this is how much you could explain by geography, where people live, which in turn is linked to deprivation. And then this third bar adds in other socioeconomic characteristics. And you can see that more than half the excess in these different ethnic groups can be accounted for by geography and other socioeconomic characteristics. In the case of Bangladeshi and Pakistani, pre-existing ill health is also important. Been a lot of debate about this. When these were published a few months ago, I was asked what I thought about it, and I said structural racism. The Sewell report said, no, there isn't structural racism in Britain. And in fact, individuals and communities should be encouraged to take control of their lives. Whereas the implication of structural racism is, no, let's actually deal with the structural causes. And this is particularly an issue for COVID-19, not for mortality more generally. And then when we look at excess mortality, so excess mortality is a way of comparing countries that gets round the problem of differences in style of diagnosis. It means you take how many deaths would you predict to occur in the first half of 2020 based on the previous 5 years, and how many did occur. And that's the excess, age standardized. And you see the excess in England was higher than in Scotland, higher than in Wales, higher than in Northern Ireland. And in fact, the UK had the highest excess of any rich country in 2020. We're watching with alarm what's going on in India now. But during the 2020 part of the pandemic, the excess in the UK was bigger than in any other rich country, including the United States. And I ask myself, what's the link between the pre-pandemic situation and what happened during the pandemic? I think of health as a measure of societal success. So pre-pandemic, life expectancy was stalling, inequalities were increasing, and life expectancy for the poorest people was falling. And that slowdown in life expectancy was nearly the slowest of all rich countries, except, as I've said, Iceland and the US. If health is a measure of societal success, it means that society was not improving and inequalities in society were increasing. All of that was pre-pandemic. And then during the pandemic, we had the highest excess mortality. So what's the link between these two? And I speculate poor governance and political culture. Social and economic inequalities were increasing. There was a reduction in spending on public services. Pre-pandemic, we were ill-prepared, and we were unhealthy coming into the pandemic. By the way, the pandemic wasn't all bad. In the USA, from March to December 2020, America's 651 billionaires had a growth in wealth of $1 trillion. Get that? $1,000 billion. That's a growth of 36%, from 3 trillion to 4 trillion. They could write checks, those 651 billionaires, of $3,000 for each of 330 million Americans and be as rich as they were before the pandemic started. Get the feeling there's something wrong with this? Now, this is an egregious figure, but it sums up what happened during the pandemic. The rich got richer and the poor got poorer. The inequalities increased. Lord Peter Hennessy, the historian, contacted me over the New Year period and said, your Build Back Fairer report is a Beveridge report for our time. If you remember the Beveridge report, Beveridge said want is one only of 5 giants on the road of reconstruction, and in some ways the easiest to attack. The others are disease, ignorance, squalor, and idleness. And my way of thinking about that is these 4 giants relate to the 5th disease. So want, that's relative deprivation, living as a child at less than 60% median income. Squalor is absolute deprivation, rough sleeping, homelessness, lack of food for your family, ignorance, education, and idleness, unemployment, or I would add poor quality work. So relative deprivation, absolute deprivation, education, employment, and working conditions. In fact, rather similar to what I talked about in my 2010 and 2020 reports. So what did we recommend? How are we going to build back fairer? We said, build back fairer. We don't want to go back to the status quo ante. Where we were in February 2020 was far from desirable, as I've shown you. And we had a set of specific recommendations related to the 6 that I had in 2010. Give every child the best start in life, education and lifelong learning, fair employment and good work for all, having enough money to live on, create and develop healthy and sustainable places and communities, and taking a social determinants approach to prevention. But we have to deal with these. Poor governance and political culture, increasing social and economic inequalities, the reduction in spending on public services, and getting the country healthy again. So my overarching recommendation was to put a fair distribution of health and well-being at the heart of all government policy. Thank you.
So Michael, what an absolute masterclass in timing that was. So you made my job very easy. I would invite anyone to start to engage with questions in the sidebar. But one for myself, I love the concept of factfulness, and I found your presentation to be very factful. Where does fact meet politics and government policy? Because that's something that in policing is a blurry line that maybe you can help us from a health perspective.
Yeah, people have said to me, I'm delighted you like factfulness. So do I. Hans Rosling's book is wonderful. And Hans Rosling, the late Hans Rosling, was wonderful. And that's my tradition. The evidence is what really matters. Now, people have said to me, oh, politicians don't listen to evidence. You know, you never change policy by evidence. Well, okay, maybe, but I'm not suited to be in a smoke-filled room, or whatever the modern equivalent of a smoke-filled room is. That's not what I do. I don't get round a politician's table and argue from my prejudice. I argue from the evidence. And that is what I do. I think it's absolutely vital. And we can see, you know, look at what happened in the United States over the last 4 years, where you have a climate where the evidence plays no role at all in policy making. You actually don't get policy making. You get God knows what you get, but you get a climate of fear and distrust and hatred. When we've got evidence, we can have real arguments, and I expect them and I welcome them. People to the right of the spectrum will say, yeah, I'm looking at your evidence, but I think this health is a matter of personal responsibility. Parents have only themselves to blame if their children are unhealthy or get involved in crime. And to the left of the spectrum, they say, no, we've got to deal with poverty and inequality. Great, let's have an argument about that. That's a good argument to have, provided we're looking at the evidence. But if we're just talking from prejudices, so take the, sorry to go on so long, but I finished 3 minutes early, so it allows me to. So take the argument about food. You've heard, as I've heard, many politicians say, oh, the problem is poor people are lazy, they don't know how to cook. I could survive on a low budget. Yeah, I could teach them how to cook and so on. Well, what I've shown you is that if you're in the bottom 10% of household income, you need to spend 74% of that income on food to eat healthily. So whatever prejudice you have about people being feckless or lazy or whatever is contradicted by the evidence. They can't eat healthily if they haven't got enough money. It's not the poor who are to blame, it's their poverty that is to blame. So the evidence really ought to influence the argument.
So Hans Rosling postured that factfulness would be the end of politics. I unfortunately fear that the growth of social media and fake news, fake evidence is probably pushing us in the other direction. But Michael, we've got some brilliant questions. Nick Caveney asks how policing could engage in a prevention agenda. But if I can add a nuance to that, I'm very interested in the establishment of this NHS policy sea change from competition to collaboration and the establishment of integrated care systems. The police are not in that partnership. So Nick Caveney asks, how can we engage in wider prevention? And I'm saying, but we're not even at the table.
Well, yeah, it's a very good question. And I was involved in a discussion yesterday about devolution and integrated care partnerships. And I said almost this point, you've got to get the other players, the other important players around the table. It's not enough to get the health and social care services linked up. That's very good to get them linked up, replacing market-driven competition by cooperation, great. But you need the other key players. You need local government, you need the police, you need the fire and rescue service. And I said that. And when I've been to Coventry, for example, which declared itself a Marmot city, I don't mean metaphorically to Coventry, I mean literally to Coventry, which declared itself a Marmot city, the police were sitting round the table. They were players. When I went to Gloucestershire, to a deprived part of Gloucestershire, the police were players with voluntary and community sector, with local government, with the health care sector. So, yeah, I said this to this commission yesterday, that if you've only got integrated care systems without collaboration with the other important parts of the system, you will not reduce health inequalities.
So in my own interjection, and I see there are many senior and aspiring senior leaders in the audience, world-class leadership for me in the 2020s is going to be about influence. So if you're not at the table, find out how you are going to be influential and influence it. So we've got a question from Alistair Null in the sidebar. Alistair asks, and I think it's a really good question in relation to the data you put up, how would you recommend, Sir Michael, the police adopt enforcement tactics which increase our legitimacy when we're dealing with the poorest in society? And there is something here about an interesting point about the chicken and the egg. Actually, what comes first, the poverty or the crime? For me, having looked at your data, it's the poverty. So yeah. What could that data mean about our legitimacy when we're policing the least well-off?
Well, let's take an extreme example for the moment. which is policing in the United States. Policing in the United States, there was an interesting comment in the Observer this weekend, essentially saying the police have declared war on poverty, but not to reduce poverty, but declared war on the poor. And they're doing it when war's not a bad metaphor. They've got all this equipment from the Defense Department that goes to police departments. It's really frightening. Do you remember that memorable picture, was it last year, of a young woman, scantily clad, skinny young woman, and a policeman is backpedaling from her. She's standing up. And there was one that, I don't know if you saw it on social media. It was at the time of the Black Lives Matter outside Washington, outside the White House demonstration. And here were National Guards and, armed to the hilt. And this young woman talking to the guardsman, and she turned him around. He said, "I'm on your side." And, this articulate, I'm tearing up just talking about it. This articulate young woman talking to this armed officer and convincing him. And she did. And, he was obviously someone of good faith, a decent person. And she convinced him that we're not your enemy. And they laid off. So that's an extreme example. We can see how bad that is. Now, as a law-abiding citizen, I want the police to be out there catching the criminals. And if people are committing mayhem, that's an important function of the police to deal with that. But and I feel the same way about doctors. Being a doctor and a former president of the World Medical Association, when people get sick, I want the doctors there to deal with the sickness. But what I want to do is try and prevent people getting sick prematurely by improving social conditions. And if it's the case, so yes, it may well be that if you lock somebody up, it increases their likelihood of getting mental illness. But if more likely their disordered behavior is linked to their mental illness, then let's deal with the causes of the mental illness, not simply put them in prison as a result of it. And I'm fully aware of this chicken and egg that you talk about. What's a policeman or a police force supposed to do when young people are kicking up a fuss and making mayhem? They've got to control, keep the peace, etc. What do? They let the young person go to commit more crime? Well, we know putting them in prison is a terribly bad thing to do for the individual. So that means, like I say with the healthcare services, it means working in partnership.
Yeah, I think my empathy is with that. Policing can achieve very little on its own, and it must be part of the system, and it must influence. It must be in partnership. Interesting what you said about the impact those images from Washington had on you. My own force has been criticised for letting the Colston statue come down and not triggering a riot, and then on the other hand being rather too rough in some of our recent disorders. It does feel as though we are battered by every aspect of a very divided society, actually, Michael. Very divided doesn't help us. And I fear that these inequalities that you highlight so capably are going to lead to some more public disorder. Can I ask a question that's been raised by Jane Roberts? And I'm curious about this as well, because you're very calm, very professional, and it's not necessarily an academic question, but how do you contain a sense of frustration that this has been a lost decade when you've factfully spelled out causes and consequences of health and social and economic policy?
Well, I think it would be totally useless and painful to bang my head against a wall. It's far more rewarding if you push on a door and it's closed, to push on a door that's open. So if the national government goes off in a different direction, damaging health, increasing inequalities, but the city of Coventry, if Greater Manchester says we want to become a Marmot region, I can't cope with the requests that we're getting from cities and regions in the UK. While we had the national government in Britain that, as I showed you, was taking steps that damaged the well-being of the population, the European region of the World Health Organization invited me to chair a commission in Europe. And then the American region of WHO, the Americas, invited me to chair the commission of PAHO, the Pan American Health Organization, on equity and health inequalities in the Americas. And then in March, on March the 31st, we launched Build Back Fairer, the Commission on Social Determinants of Health of the Eastern Mediterranean region of WHO. So I don't feel frustrated. I feel like a winning team.
I mean, Sir Michael, we've got to 12. What a beautiful way to finish. I see a man with a mind and a body much younger than his years and experience, and what energy to change the world, and what a reply all of us in policing and leadership can learn from your lesson of resilience and stoicism about I'm going to go where I'm going to win, and we are winning, by the way. So the truth will win out. It's a pleasure to spend some time with you.